Now, I'd ask you to put another slide up on the screen, please. It shows where we've been and where we are. So you'll see on the screen a blue line which shows the trends in hospitalization since the middle of March. And you can see in that blue line, that's our actual experience. It shows a steady, consistent decline in hospitalizations since our peak at the end of April. Remember, we keep our eye firmly on hospitalizations because that's a fact. Number of cases, it depends on how, that can vary. It depends on how many people you test. Testing, metrics vary. Hospitalizations are it's a fact, it's known, and it's undisputed. And so the fact that our hospitalizations have been in steady decline is a good thing. You'll also see two paths of what next month could look like. If we continue to do what we're doing, social distancing, mask wearing, keeping your social circles small, social gatherings 25 or fewer, then I expect we'll continue on the blue line that you see in front of you. That's my expectation. If you were to say, Governor, what do you think? I have confidence. I'm leading with confidence, putting my faith in Rhode Island. I expect the blue line. However, if we start to relax and don't wear masks, bunch up at the beach, crowd into bars, take a risk and go to work when we feel sick, then our rate of spread will increase. We could start to look very much like many other states. And we think, we've done certain assumptions, we'll very likely end up on the yellow line that's on your screen, and possibly much higher. If that were to happen, then I have to go back and impose restrictions. Why do we put this up? Because this is what we do all day, the what-if scenarios. And there are assumptions, of course, behind all of these scenarios and behind the yellow line. But the reality is that it's kind of a formula. We now know less mask wearing, more congregating, leads to a higher rate of infection, leads to more hospitalizations and more cases. And so that yellow line is our attempt to share what we think might happen if in the next few weeks people stop following the rules. So let's stick to the blue line. That's what I'm asking the people of Rhode Island. Let's stick to the blue line. Let's beat the blue line. And by the way, it's simple steps. It's the most maddening thing about this virus, is deadly as it is, and as sophisticated as our approach to it is, with technology and such, it's actually pretty simple. Stay out of big groups, stay home if you're sick, keep a social distance, and wear your masks. If we do that, we're going to hit the blue line, and I feel that we'll continue to be in good shape, and we'll be able to open the economy further instead of turning the dial back, as we're seeing happening all over the country, frankly, all over the world.